Holistic Glow. This week, we're going to go through my lab bag. I am a pediatric visit nurse and I do all kinds of things, but something I do pretty regularly is collect blood specimens. A lot of the lab draws that I do are for kids who are on medications after having had an organ transplant, or who are tube fed and need routine monitoring of their nutrition levels, or who might be on seizure medications and need to make sure that the medications that they're on are at Peach, get down. Get out of here. We need to make sure that the level of medication is stable in their body. Since my other bag doesn't have enough room in it with all of the other things that I need to carry, I have a bag that is specifically dedicated to lab collection. Come along and we'll check out all the pockets that we've got. So in the front pocket of my lab bag, I keep the tools for checking vitals in my front pocket. So I've got my lovely cardiology. This one's fun because it has a rainbow on the diaphragm. Very pretty. So that one's fun. And I've got another Vicks thermometer. I love these little Vicks. I've got a pediatric sized manual blood pressure cuff. I also have an infant size cuff, since those tend to be the two sizes I need the most frequently. They're the ones that I keep in the front of this bag. A tape measure, useful for checking head circumference. Uh-oh, I think I broke it. Maybe not. Yeah, I broke it. Whoops. Another pupil gauge, which again, the battery's dead. I can't remember the last time I've had to use this. I've also got a couple of extra batteries for my thermometer. Since this stuff lives in my trunk and I live in the upper Midwest where it likes to be freezing cold for half of the year, having extra batteries is handy because my thermometer batteries tend to die pretty quickly with as much cold as they're exposed to. Next, of course, I've got a sharps container. I love this sharps container because it fits right into the side pocket of my bag. So it can slip in and out, and it's small enough where I can actually zip the pocket closed, which is really useful when you're visiting kids, so you can completely enclose the sharps container. When it's out of sight, it's out of mind. Otherwise, kids love to reach for the red thing that has a bunch of cool shaky noises inside. On the other side, I've got, again, hand sanitizer and my little sanitizing wipes, so I can keep the bag and my supplies clean. Okay, now we get to the fun part. So in my first pocket is where I keep all of my lab tubes and needle supplies. So I keep them organized by color. So I've got my purple tubes, I've got my chemistry tubes, and I also carry peripheral tubes as well as capillary tubes. So these are smaller volume tubes. Then I've got a little plastic container that I keep extra gloves in, my tourniquets, and then a variety of needles. I like to use butterflies for most of my blood draws, and I carry the sizes 25 and 23 gauge. So the 25 tends to be used for kids that are itty bitty teeny tiny, have very small fragile veins, and then the 23 gauge tends to be used for everything else. And then I have tenderfoots. I carry also, again, two sizes. So I carry the tenderfoot newborn and the tenderfoot toddler. So these can be used for capillary draws. So they can be used for heel pokes, toe pokes, finger pokes, whatever makes the most sense for the size and age and development level of the kid that you're seeing. Then I've got the middle pocket. This is where I keep my prepared lab bags, and each bag comes with the same supplies. So each bag comes with a drape, a pair of gloves, a syringe, and a transfer device, so we can transfer the blood from our syringe after it's collected to those chemistry tubes or to the lab tubes. And then each bag comes with a Band-Aid, alcohol wipes, and some gauze. I always like to keep a couple of prepared lab bags in here. I also carry extra syringes and transfer devices just in case. And I also keep my urine collection supplies in here. So I do carry a couple of different urinary catheters in different sizes and lengths, as well as some specimen cups. Okay, so the back pocket, I carry lots of extra alcohol wipes. You can never have too many. I've got a pocket with a lot of different Band-Aids, stickers. I love to carry stickers because everyone knows that getting your blood drawn is no fun. And having some special stickers available when you're done is the best. So right now I've got some Moana stickers, some Frozen stickers. I've got some scary dinosaurs and Mickey Mouse. Enough variety that I can appeal to most of the kids that I see. I've got some extra gauze on the bottom, and then just some random supplies on this side. So I've got skin barrier wipes, some urine collection bags. So if we're going to try to get a urine specimen on an infant or even a little toddler, I've got some adhesive bags that we can apply to collect sample. Along with the urine collection supplies, I have some antiseptic wipes that can be used prior to getting your collection. Here's something I don't use super frequently, but we've got stool sample cards. So we've got a couple of little wooden sticks that you can use to collect a bit of a stool specimen and spread them on this card before sending them into the lab. A couple pairs of good old bandage scissors. And finally, I like to keep a little bag of needles and syringes just in case the kid that I'm going to see for a lab draw might also need an injection while I'm visiting. All right, and then finally, I've got these nice clear dividers in the middle. So I like to keep a stack of lab recs for each of the hospital systems that we work with, as well as some extra drapes and biohazard bags, and then some blank labels. So I have labels that are printed with the information that I'll need to put on the lab tubes once they're collected. Okay, and then the final pocket on the very back side of the bag is where, again, I have my drape that I can lay out so I can set my supplies on something that I know is clean versus setting it on the floor or a countertop. A mask, as well as a whole collection of pens. Okay, so that is everything that I carry with me in my lab collection bag. If you liked this video, give it a thumbs up. If you're interested in learning more about skilled nursing or pediatric nursing, let me know in the comments below.